Did you know that every 40 seconds someone suffers from a stroke, and every 5 minutes someone dies from it? But here's the shocking truth. For many seniors, your bathroom habits could be the secret trigger to an increased stroke risk, and most people don't even realize it. It's terrifying to think that something as simple as how you go about your bathroom routine could be silently raising your risk by 300%. The habits you do daily, from how you sit to how you breathe while you wipe, can all affect your blood pressure, brain health, and artery health in ways that are far worse than you might imagine. But here's the crazy part. Most doctors never ask about these habits. What's even more frightening is that these habits are so deeply ingrained in our daily routines that we often don't even think to question them. These silent actions could be pushing us closer to a stroke without any obvious signs or symptoms until it's too late. Researchers have been warning about this for years, but many of us continue with our routines out of habit, never realizing the dangers they might carry. Today, we're going to reveal 7 of the most dangerous bathroom habits that can be silently increasing your stroke risk, even if you've been doing them for years. Stick around because habit number 1 is the one that nearly every senior does, and it's way more dangerous than you think. Before we dive in, I'd love to hear from you. What's your morning routine like? Do you ever rush through your bathroom habits or take shortcuts when you're in a hurry? Do you drink water as soon as you wake up? Drop your thoughts and questions in the comments below, and I'll be First habit, rushing through urination without fully emptying your bladder. All right, let's start with habit number 7, rushing through your morning urination without fully emptying your bladder. It sounds simple enough, right? You might think that if you don't feel the urge to go anymore, you're all set. But in reality, this could be a major problem. A study published in the International Urology Journal found that when you don't fully empty your bladder, it can raise your systolic blood pressure by up to 30 mmHg, a huge risk factor for stroke. What happens is this. When your bladder isn't completely emptied, your body stays in a mild state of fight or flight, activating the sympathetic nervous system. This keeps your blood pressure elevated, your arteries tighter, and less oxygen reaches your brain. Over time, this increases the risk of plaque buildup in your arteries, and eventually this can lead to a stroke. In seniors, this is especially dangerous because the bladder muscles weaken by 50% after age 65. So even though you think you're finished, your bladder may still be holding onto urine. This not only raises your blood pressure but also quietly damages your arteries, adding stress to your cardiovascular system every single day. Over time, this daily stress can accumulate and significantly increase your risk of having a stroke. Real-life story. I recall a patient, Mr. Douglas, a 67-year-old man who had been complaining of frequent urination but never thought much about it. After his stroke, doctors discovered that his bladder retention had been silently increasing his blood pressure for years, contributing to his stroke. A simple habit like double voiding could have helped avoid this. The solution? Try double voiding. After urination, wait 10 seconds and try again. This simple trick can reduce bladder pressure by up to 60%, helping keep your blood pressure in check. If you're a man with an enlarged prostate, speak to your doctor about alpha blockers to help relax the bladder muscles. For women, pelvic floor therapy can be a great solution to regain control and reduce strain. Second habit, skipping the nightly teeth brushing. Now let's move on to habit number 6, skipping your nightly teeth brushing. This one may surprise you, but here's why it's so critical. Researchers at the University of South Carolina found that seniors who brush their teeth only once a day have a 70% higher risk of stroke compared to those who brush twice a day. When you skip brushing at night, plaque builds up in your mouth. This plaque is full of bacteria, and those bacteria can enter your bloodstream through small cuts in your gums, especially if you have gum disease. Once these bacteria enter your bloodstream, they trigger inflammation in your arteries, making your blood thicker and more likely to form clots. And clots are the #1 cause of ischemic strokes. Real-life story, take Mrs. Jenkins, a 72-year-old woman who never took oral hygiene seriously. She brushed once a day and had frequent gum issues. A few months after a routine checkup, she had a stroke that doctors attributed to the infection in her gums, which had slowly worked its way into her bloodstream and caused the stroke. This illustrates just how powerful the connection between oral health and cardiovascular health really is. Ignoring it can lead to serious consequences, and something as simple as brushing your teeth twice a day can make a huge difference. A 2019 study published in Stroke Journal found that people with gum disease were twice as likely to suffer a stroke, even after accounting for other risk factors like blood pressure, smoking, and age. This proves that oral hygiene is much more important than you might think when it comes to heart and brain health. The fix: brush your teeth twice a day and make sure you brush at night before going to bed. Use a soft bristled toothbrush and avoid brushing too hard. This can open up more cuts in your gums, allowing more bacteria to enter your bloodstream. Don't forget your tongue. Using a tongue scraper helps remove even more bacteria, reducing your risk significantly. If you're unsure about your oral health, make an appointment with a dentist for a checkup and cleaning. It can make all the difference in preventing not only gum disease, but also stroke. Third habit, dehydration in the morning. Next up is habit number 5, starting your day dehydrated. Many seniors are guilty of rushing to the bathroom right after waking up without drinking any water first. This is a big mistake, and here's why. When you wake up, your body is at its most dehydrated state. Your blood is thicker, your arteries are tighter, and your heart is struggling to push blood through the vessels. Now, add the strain of urinating on top of that, and you have a recipe for disaster. A study published in The Lancet found that stroke risk increases by over 80% in the early morning hours due to dehydration. If you're urinating without rehydrating first, you're putting enormous pressure on your heart and brain, and that can trigger a stroke. Dr. John Thompson, a leading cardiologist, once said, "Morning dehydration is like a silent time bomb for the elderly, silently amplifying every strain your body goes through." The fix: drink water as soon as you wake up. Keep a glass or bottle next to your bed and drink 300–500 ml of water before you even get out of bed. This simple act will help thin your blood, improve circulation, and reduce the strain on your arteries. This small change can make a huge difference in your overall health and significantly lower your stroke risk. If you feel lightheaded or dizzy in the mornings, this could be a sign that dehydration is affecting your body. Hydrating first thing in the morning can help prevent these symptoms, and over time, it can significantly reduce your stroke risk. Fourth habit, hot showers without cooling down. Now let's talk about habit number 4, taking long hot showers without cooling down. It feels good to get into a warm shower, especially on cold mornings, but hot showers can actually be harmful for seniors. When you step into hot water, your blood vessels expand, which can cause a drop in blood pressure. But when you step out of the shower into cooler air, your blood vessels constrict quickly, and this sudden change in pressure can be dangerous for your arteries. The human body is designed to adapt to temperature changes, But when you subject yourself to rapid shifts in temperature, it can put immense strain on your circulatory system. Research from the Journal of Applied Physiology showed that seniors who took long, hot showers without cooling down experienced a 20 mmHg drop in blood pressure, and then a rapid increase when stepping out into cooler air. This fluctuation can disrupt blood flow, leading to potential clot formation or a ruptured artery, both of which are significant risk factors for stroke. A sudden drop in blood pressure followed by a quick rise can also lead to dizziness, which is especially dangerous for seniors who may already have balance issues. If this fluctuation happens in a person with weakened arteries or plaque buildup, it can increase the likelihood of a stroke, which can be devastating. Real-life story. I once had a patient named Mr. Alston, who was 70 years old and had a history of high blood pressure. He'd enjoyed long, steamy showers to relax, especially during the colder months. He didn't think much of it until one day, after a shower, he suddenly felt lightheaded and collapsed. His blood pressure had dropped significantly, then spiked when he stepped out of the shower into the cooler air. This fluctuation caused his blood vessels to strain, and he was fortunate not to suffer a stroke that day, but it was a wake-up call. The fix: end your shower with cool or lukewarm water for about 30 seconds. This simple adjustment helps stabilize your blood pressure and reduces the risk of extreme fluctuations. Gradually cooling your body down helps your blood vessels adapt to temperature changes more effectively. Also, avoid standing still for too long in one position under hot water. It can decrease circulation to your brain and cause dizziness. If you're concerned about the effect of hot showers on your blood pressure, try showering at a more moderate temperature and keep your showers short. A cooler shower can actually invigorate you, helping to improve circulation and lowering the risk of dangerous blood pressure drops. Fifth habit: straining during bowel movements. The next habit is number 3, straining during bowel movements. Over 40% of seniors suffer from chronic constipation, and many of them strain excessively to pass stool. While this may seem like a common issue, the danger lies in the increased pressure that straining places on your blood vessels, particularly in your brain. Straining too hard can raise your blood pressure rapidly, and this can trigger a bleeding stroke. When you strain, especially during a bowel movement, you activate a process known as the Valsalva maneuver, which involves holding your breath and bearing down. This causes a sharp spike in blood pressure, and in the case of seniors whose arteries may be stiffened or weakened due to age, this spike can rupture a blood vessel in the brain, leading to a hemorrhagic stroke. A study published in Stroke Journal found that intense straining during bowel movements can increase the risk of intracerebral hemorrhage by over 300%. This is a devastating form of stroke caused by a blood vessel rupture. The pressure exerted on the arteries, combined with a lack of oxygen and circulation in the brain, creates the perfect storm for a stroke. Real-life story. I had a patient named Mrs. Henderson, a 74-year-old woman who was constantly dealing with constipation. She would spend excessive amounts of time straining on the toilet, thinking it was just a normal part of aging. One morning, after a particularly forceful bout of straining, she collapsed in her bathroom. The doctors later explained that the excessive strain had caused a ruptured artery in her brain, resulting in a stroke. This could have been prevented with a more mindful approach to her bowel health. The fix: use a footstool or adopt a squat position on the toilet to better align your colon. This can reduce the need for excessive straining. Also, staying hydrated is crucial. Aim to drink at least 8 glasses of water a day to keep your stool soft and reduce constipation. Fiber-rich foods like prunes, chia seeds, and oats can also help keep things moving smoothly. Additionally, consider taking a walk after meals. Light exercise can stimulate digestion and prevent constipation, which in turn reduces the need to strain. Sixth habit, sitting too long on the toilet. Now let's move to number 2, sitting too long on the toilet while scrolling your phone. We've all done it, right? But sitting in one position for too long can actually be harmful for your brain. A study published in Neurology found that seniors who sit for more than 15 minutes at a time on the toilet have a significant drop in cerebral blood flow, up to 17%. When you sit still for too long, blood pools in your legs, and that reduces circulation to your brain. This can increase the chances of forming blood clots and cause damage to your arteries. Combine that with straining and poor posture, and it becomes a dangerous combination for stroke risk. Sitting for prolonged periods of time, especially in a flexed position, puts extra pressure on the lower body, which reduces the return of blood to the brain. This reduced circulation means that your brain isn't receiving enough oxygen, which can contribute to clot formation, vascular damage, and increased stroke risk. Real-life story: I had a patient, Mr. Richards, who was in his late 60s. He had the habit of reading articles on his phone while sitting on the toilet for extended periods. One day, after sitting for nearly 30 minutes, he felt a sudden rush of dizziness when standing up. His blood pressure dropped quickly, and he had to be rushed to the hospital for a near-miss stroke. The doctors confirmed that the lack of circulation combined with his prolonged sitting had triggered this close call. The fix: leave your phone outside the bathroom. Set a timer so you don't stay seated for too long. If you need to read, use a book or magazine at eye level to avoid looking down for long periods. After finishing, take a short walk to improve your circulation and help oxygenate your brain. The key here is moderation. Prolonged sitting, especially in one position, restricts circulation and can lead to both immediate and long-term health issues. Seventh habit: holding your breath while straining or standing quickly. Finally, let's look at habit number 1, holding your breath while straining or standing up quickly. This is a huge problem for seniors, and here's why. When you hold your breath during tasks like standing up, wiping, or straining, you're increasing pressure inside your chest, which reduces blood flow to your heart. This makes it harder for your brain to get oxygen, and it can cause a sudden spike in blood pressure, a dangerous situation that can trigger a stroke. When you hold your breath, you essentially trap pressure in your chest. This causes increased pressure in the arteries, which can rupture weakened blood vessels in the brain. A 90 mmHg spike in blood pressure is enough to cause serious damage, and this can happen in seconds. Real-life story: I remember a patient named Mr. Stevens, a 69-year-old man who would often hold his breath while getting up quickly from a seated position. One morning, after standing up suddenly to answer the door, he collapsed. His blood pressure had spiked rapidly, which led to a stroke. The doctor explained that holding his breath in such situations had created a dangerous spike in pressure, which could have been avoided with mindful breathing. The fix: practice steady breathing. Inhale deeply before standing up and exhale slowly while moving. If you feel lightheaded, sit back down and take slow, controlled breaths. A grab bar can help reduce the strain while standing, and try to rise slowly instead of quickly. The act of breathing steadily and gradually can lower internal pressure, ensuring that you don't put undue strain on your body and risk a spike in blood pressure. This simple habit could be the difference between health and a stroke. There you have it, 7 bathroom habits that could be silently increasing your stroke risk. But remember, you're not powerless. By making simple adjustments like drinking water when you wake up, brushing twice a day, using proper posture, and breathing steadily, you can significantly lower your stroke risk and improve your overall health. These small yet powerful changes are within your control and can have a profound impact on your long-term well-being. Health is not just about managing what comes your way. It's about taking proactive steps to safeguard your future. If you found this video helpful, be sure to hit the like button, subscribe, and share this with someone who might benefit from this life-changing information. And don't forget to leave your thoughts and questions in the comments. I love hearing from you and supporting you on your health journey. Take care of your body, stay safe, and remember, health is a lifelong commitment. I'll see you in the next video. Stay well and keep thriving.